From care to cure towards the elimination of HIV. That was the theme of an international HIV expert summit hosted by the Caribbean Cytometry and Analytical Society, CCAS, last week in St. Lucia. That theme demonstrated a shift in paradigm. CCAS chairperson Professor Clive Landis explains how the region can test, treat, and defeat HIV.
HIV has long ceased to be a death sentence. You can live very well with HIV, but the key point is that when someone is on treatment with HIV, then they also become non-infectious because the HIV is suppressed in their body and cannot be transmitted. And guess what? The same thing happens with sexual transmission of HIV. If the person who has HIV is on treatment, then that person, he or she, cannot pass the virus on to their sexual partner. What we want to say to persons in the Caribbean is that if we can test persons, and if they're HIV positive, we can treat them, together we can defeat this disease because it cannot be transmitted anymore and it'll eventually fizzle out.
But there's something very important for that process to be successful. Attitudes towards HIV testing and treatment can either hinder or help the process. That's a message we often hear in various forms from health officials and others in discussion on fighting HIV, and it was a message that Professor Landis stressed.
If we put up barriers in our community, usually out of fear because we're so worried about this as being a death sentence, which really isn't, then persons won't feel comfortable enough to be treated or even come forward for testing. And so the whole effort will fail.
During the conference, Professor Landis pointed to successes of the Caribbean HIV response, including the validation of 7 countries and territories as having eliminated mother-to-child HIV transmission. But UNAIDS Director for Latin America and the Caribbean, Dr. Cesar Nunez, shared the latest HIV data, which show that the Caribbean must accelerate progress if it's to meet the targets that will set it on a track to end the AIDS epidemic by the year 2030. He said the AIDS response is at a precarious point in the Caribbean, and while there has been partial success in saving lives and stopping new HIV infections, the pace of progress is not matching global ambition. Dawn Paris for Newsline Health.